You're listening to the new media. You're listening to Mitchell Talks. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter at Mitchell Talks. Welcome to part one of a Mitchell Talks series, the proposed tobacco tax increase and why health advocates are pushing so hard. Our guest is Dr. Bob McCaffrey, physician and professor at the University of Oklahoma College of Medicine and Associate Director of Policy with the Oklahoma Tobacco Research Center. The legislature is discussing the tobacco tax, along with their nearly $1 billion hole. One of the key factors in trying to solve that has been proposal by leadership to do something about the tobacco tax, increase it. Let's talk about the human aspect of this. Cigarette tax increase would do what for individuals and for the state of Oklahoma?
Yeah, I'm glad you started off with that, Scott, because that's really been my focus. You know, I am a pulmonary physician. This is a very personal issue with me. My father died prematurely because of tobacco. I've had friends who have died, and quite honestly, I don't want to walk into another hospital room watching and comforting a husband holding his wife who's coughing up blood from her lung cancer. I don't want to try to explain to another family with their loved one on a ventilator, you know, how bad the lung disease is. I don't want to see somebody else walking into my clinic room, barely able to get in, you know, pushing their oxygen cart. So this becomes a very personal issue with me. And I think that we have been fighting tobacco for a long time. And I will just say, quite frankly, the tobacco industry has had a heavy hand, I wouldn't necessarily say control, over our state legislature for a number of years. And we have a number of documents from the tobacco industry that in fact documents how strong their hold has been on our legislature. And that's in the past. I'm not trying to bring this up into the future, but I think that this is a vital issue for our state. I think, as everybody knows, our state has a very, very poor health status right now. We're overall something, I don't remember the most recent numbers, but I think probably in the mid-40s, maybe low 40s in terms of our health status. And this is in large part due to our health care choices, and specifically tobacco. You know, tobacco is our most preventable cause of premature death. That's in the United States, that's in Oklahoma, that's across the world. And that's the key, it's preventable. We can do something about this. And, you know, we've talked about, from a political standpoint, the income from a tobacco tax. That's not my main interest. What I know is that people stop smoking or they smoke less when the price goes up. The tobacco companies know that. That's why we have 12 lobbyists up there in the legislature now trying to prevent this. The tobacco companies are scared to death of an increase in tax. And they have right to be, because the data clearly show that people stop smoking when the price goes up, and specifically the tax goes up. So, you know, should that happen? You know, should we have that $1.50 increase in tax this year? We'll sell 26 million fewer packs in Oklahoma next year. 26 million. You know, we will see a decrease in both smoking, the number of people who smoke and the amount they smoke. So we can expect to see someplace in the range of 4 to 7% fewer smokers, which is, it may sound like a small number, but if you multiply that by the number of smokers and it goes on year after year, that is a huge number and would be a tremendous help to improve our state's health status. You know, right now about 2,500 children start smoking every year. If we continue at the same rate, we know that about almost 90,000 of our children under age 17 will die of a tobacco-related disease. And these are not pleasant diseases. Tobacco causes almost a third of all cancers. And let me emphasize all, because it's not just lung cancer. It's cancers of almost every organ in the body related to tobacco use. Cardiovascular disease is probably the greatest killer. As I said, my dad died prematurely. He had a heart attack. But we know that in cities, this is a little bit different, but in cities that institute clean air laws, which means that people are smoking less, and this gets into the secondhand smoke issue, we know that the heart attack rate within the first year goes down by 15 to 20%. So, these relatively simple, easy steps. Now, I know that any tax is not, quote, easy, but I consider this a moral issue. We can prevent this. If we don't care about our kids or about the current smokers, sure, we could go ahead and continue as we are. Because, the tax brings in right now about $250 million into the state. Well, is that a good business plan?
It depends on what your expenses are, doesn't it?
It depends on your expenses. And it costs us, in terms of direct medical care and in terms of time off work, costs us about $3.6 billion. So, I don't think anybody would say that that's a good investment.
Coming Friday, Part 2. Thanks for listening to Mitchell Talks. Follow us on Facebook and on Twitter @Mitchell Talks. You're listening to the new media, the Mitchell Talks Network. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter @Mitchell Talks.